Hello everyone, welcome to Short Notes series. So in this set of videos we will be discussing 5 mark questions. Today we will discuss about Duchenne Muscular Dystrophy, DMD. So what is Duchenne Muscular Dystrophy? It is a severe X-linked recessive disorder characterized by progressive muscle weakness and degeneration. It primarily affects boys and it leads to disability and premature death due to respiratory or cardiac failure. Coming to the epidemiology, it occurs approximately in 1 in 3,500 male births worldwide, rarely affects female due to the X inactivation or chromosomal abnormalities. First described by Dr. Duchenne in 1861, and it represents the most common and severe form of muscular dystrophy. Coming to the genetic basis and pathophysiology, it is caused by mutation in the DMD gene located in the short arm of X chromosome, that is XP21. The gene that encodes for dystrophin, which is a protein that connects the cytoskeleton of muscle fibers to the extracellular matrix via dystrophin glycophorin complex, is either absent or there is a defect in the function due to a mutation. This is the basic pathology in case of Duchenne muscular dystrophy, which will result in muscle fiber fragility during contraction. This leads to more calcium influx, necrosis, replacement of muscle tissues by fat and connective tissue. Then progressive muscle degeneration causes weakness and loss of function. Coming to the clinical features, the usual age of onset is between 2 to 5 years of age in male children. Weakness begins in proximal muscle first, then distal, before the distal ones. Pelvic girdle, thigh muscles are affected first usually, leading to difficulty in rising from the floor, which is usually seen in Gower sign, which is pathognomic of Duchenne muscular dystrophy, followed by involvement of shoulder girdle muscles, that is the deltoid and biceps. There will be calf pseudo-hypertrophy due to the deposit of fat and fibrous tissue infiltration. Neck flexors and abdominal muscle weaken early, causing lordotic posture. So what is Gower sign? It is a characteristic maneuver when child uses hands to walk up the thighs to stand due to pelvic and thigh muscle weakness. Eventually leads to loss of ambulation by 10 to 12 years of age. Respiratory and cardiac muscles are involved in later stages, resulting in death. So this is the calf muscle pseudo-hypertrophy, which we typically seen in Duchenne muscular dystrophy, and this is what we call it as Gower sign, where the child will climb up onto himself, Gower sign. And this is the mechanism of transmission, wherein an unaffected father and a carrier mother, when they marry and have children, there is a 1 in 4 chance of she having a affected son. So pseudo-hypertrophy and other features. So pseudo-hypertrophy of calf muscles, bulky calves due to fat and connective tissue replacement, and it is not due to hypertrophy. Cardiomyopathy occurs. Dilated cardiomyopathy is more common in adolescence. Respiratory failure is the final cause of death due to diaphragmatic and intercostal muscle weakness. Mild intellectual impairment may occur due to dystrophin deficiency in neurons. Skeletal deformities like contractures, scoliosis and lordosis can be seen. Coming to the investigation, serum creatinine phosphokinase will be markedly elevated 10 to 100 times than normal early in the disease. Genetic testing confirms the DMD gene mutation through PCR or MLPA. Muscle biopsy shows muscle fiber necrosis and the absence of dystrophin on immunostaining. ECG or echocardiography can be done to evaluate the cardiac involvement. Pulmonary function test can also be done for respiratory compromise. Coming to the management, so the mainstay of management includes corticosteroids, which will slow the progression, physiotherapy to prevent contractures, orthopedic aids that supports mobility, ACE inhibitors and beta blockers for cardiac myopathy, assisted ventilation for respiratory failure, prognosis, wheel-bound chair by adolescents, death by late teens or early 20s due to cardiorespiratory failure. Prevention, career detection and prenatal genetic diagnosis. Coming to the summary, DMD is a genetically X-linked disorder due to dystrophin deficiency, manifest with proximal muscle weakness, Gower sign, calf pseudo-hypertrophy. There is no cure, but steroids, physiotherapy and supportive care can prolong survival. Counseling is essential for prevention in families with affected individuals. Hope you have learnt for this short note. Thanks a lot.